When the goodness of God seems like it's passed you by, life seems hard to cope. Disappointment, mistakes will come and challenge your faith, and every day will seem like there's no hope. But with Jesus on your side, things will get better. With Jesus on your side, things will get better. So never give up, never give in. He's always on time. Never give up, never give in. The Lord is on your side. Sleepless nights and painful thoughts have left you confused, broken and hurt inside. Unanswered prayers and no one cares have made you feel all alone. With Jesus on your side.
.org, and you can email us at support@igbattmho.org, or our regular email igbatt1@aol.com. It's getting better all the time. Mental health outreach provides information and support while encouraging hope and faith to individuals who are living with the symptoms of a severe mental illness, regular mental illness, or other negative life situations. Again, you can find out more about us by logging on to our website at igbattmho.org or igbatt.com. And when you do, please leave a message, give us feedback. If you have any questions, please do so. Today I wanted to spend some time talking about medications. I titled this Medications and SMI, or Severe Mental Illness, but we're going to talk about medications in general. First of all, let me say I'm a clinical social worker, not a psychiatrist who prescribes medications, or a medical doctor, but I have been doing this for a long time. And I want to just share some observations, and I'm actually going to be using some information from the NIMH.gov. And I encourage you that when you're looking for information about mental health, one of the things you'll see when you go onto our website, most of the information there, I would say 95%, if it's not something that we wrote, comes from a government website or something, an organization that I know is reputable. Because there are a lot of information out there. There are a lot of things that's being said out there that may or may not be true. But I know when you're looking at from the NIMH.gov, for example, you're looking at information here. It's peer reviewed, and it's something that you can pretty much trust. So again, this is where I'm going to be. I'm coming from their little handout, which is mental health medications, and I'm going to be talking in general. So first of all, medications. What medications, when you first, let's say, seek out mental health treatment, okay? One of the first things that should happen is that an assessment should be done. An assessment, when we talk about mental health treatment, doesn't necessarily initially include, a height, weight, physical, blood, doctors taking blood and all that stuff initially. Sometimes the assessment will start with a period where you sit down with a clinician, whoever that person is. They ask you questions about your life, your history, what's going on, and then they go from there. So one of the questions that comes up, people will say, well, why are you asking me all these questions about my life and what happened 50 years ago? And the reason why we ask those questions is we're trying to get to know you. We're trying to assist you in getting you to better know you. So there's some of these questions that we're asking helps to form a pattern. It helps us to helps you to see, to understand how things relate to, how this relates to this and this relates to this, and just have a better understanding. It also helps us to clarify the diagnosis. So for example, you may come in and say, I feel like I'm depressed, and you may be depressed at that time, and you just want to talk about your depression, and that's fine. But we're also asking questions about other things that have happened. Because many times when you go through a person's life or you go through your life, you realize that you have a history of depression. This started years ago, but you also may notice that in addition to the depression, you also had periods where you were feeling really anxious as well. Periods to the point where your anxiety caused you not to sleep or caused you to spend more money. So we're asking all these questions so we can form a better picture, because unlike other mental health or other diagnosis, mental health diagnosis, there is no test. There is no physical test. There's no blood test per se. So a lot of how we get the diagnosis is from understanding you. It's from asking the questions. It's from understanding how you relate to the world. So yeah, it is a lot of questions. There is a lot of paperwork, because we're trying to, like I said, trying to understand you, and also at the same time trying to help you to understand yourself, because there's some things that are happening to you, you may not realize how they fit into your life now. Many times, and I think I've said this many times, is that you look at many of us, many young people in particular, let's say 20, 22, and they start having difficulties, and the family member will say, they were fine until they went away to college. They were fine until they joined the military. They were fine until they got with these particular friends. But when you look at the history, you see that they were never really fine. They were kind of like always on that edge, right? We talked about the stress vulnerability model, where a person can be vulnerable to certain diseases, to certain illnesses, and they'll be fine. But it's the stress. But if something changes in their life, will kind of push them over the edge, if I can say it like that. So, but when you go back look in the history, you realize that this person kind of has always struggled, even in junior high school. They've always had difficulty staying away. Concentrating. They may have always had challenges sitting still. They may have always had, problems interacting with other people. So you see it. So as and as they got older, they didn't get help, they just kind of dealt with it. And a lot of times with families, because we're used to the person, we just get used to the certain behaviors. And again, it's not until they go away to a new environment that you start seeing the different changes and they start having challenges. So that's just one example of asking questions. I know many people, when we finally sit down, or they finally sit down with someone, and you start doing an assessment and you start asking questions, especially around substance use, we begin to realize that the substance use that they're using drugs now was just a mask, was just a smoke screen. This was something that they started when they were junior high school, again high school, in order to cover up their other feelings that they were having. So they were always having feelings, whether it was depression or anxiety. They may not have felt like they were thinking correctly, so to speak. So they just started using drugs, because what happens is alcohol, other drugs, cocaine, marijuana, all these types of drugs, they do help your mood. They do help to calm you down. They do help to help you feel better. So once a person discovers that, they start using it. The problem with it is when you start using these types of drugs at a young age, you build up a tolerance for it, meaning the more you use, the more you want to continue to use, and then now you have a full-grown problem, so to speak. Many of the people who are in jail or in prison, many of the people who are having challenges later in life, were people who, if you look at their history, see that they had challenges early on, but they never got the help that they needed. And if they would have got the proper help, then they would have had less challenges. Okay? So again, what happens when you first go in, or what should happen, especially if we're talking about outpatient, they're going to ask you a whole bunch of questions, right, to find out what's going on with you. At that particular time, if you're coming through, let's say, the emergency room or through a psychiatric facility, same thing, they're going to ask you questions. The only difference is that if you're in an emergency room or in a psych center, they're also more than likely will get some type of labs. The doctor will draw, whether to see what's going on with you. He or she may draw some kind of labs. In an outpatient mental health clinic, we don't draw labs like that per se, unless it's something, an outpatient mental health clinic that's connected to a primary care doctor or has someone right next door. But normally when you come into an outpatient clinic for the first time, it's going to be a sit down asking a series of questions, trying to figure out what's going on with you now, how long has this been going on, has anything like this happened to you before, If it did, what were the strategies that you used before? We asked about maybe family members. Again, the reason why we asked about family members, we're looking at genetic history. There are some disorders that have a genetic component. So that's the reason why we're asking that question. Again, it helps us to understand you. Because remember, you just walked into the clinic. You've been dealing with whatever you've been dealing with all your life. We just met you. So we're trying to help you to understand by asking questions and trying to form a picture of who you are. Okay? So what happens is in an outpatient clinic, you will, more than likely first sit down and talk to someone who does the intake, which is asking a whole bunch of questions. So when you go in for an intake for the first time, please, you want to be patient because it's a process, right? Then, depending on the clinic, you'll see the psychiatrist. You may see the psychiatrist the same day, or you may see the psychiatrist later on. But at some point, you'll see the psychiatrist, or in some clinics, you may have an APRN, a psychiatric nurse, who is an advanced nurse, so who can prescribe medications. So you sit down with the prescriber, the psychiatrist, and again, he or she may ask you some of the same questions, but many times it's not as in detail as the person who did the intake, because the doctor has the intake and he or she is able to look at that. So he or she is going to ask certain questions to kind of, again, to help formulate the diagnosis, and if appropriate, they'll prescribe medications at that time. Now, something else I wanted to make about that, but it'll come back to me. When you're sitting down, with the psychiatrist, right, for the first time, they ask you those questions. They'll probably, if they prescribe medication, they'll probably give you a prescription. You can go to your pharmacist to get it filled, or if they're able to fill it there. And then you'll see the psychiatrist on a regular basis. Regular basis could be for the first time. If he or she is giving you medications for the first time, he or she may want to see you, let's say maybe next week, or in 2 weeks, or in a month, definitely monthly, so at least for a while. But each time you see the psychiatrist, they're going to ask certain questions, and I want to make sure I turn my phone off here, and the questions that they ask may seem redundant, but you have to keep in mind, they don't see you that often. If you are receiving therapy from that particular clinic, or if you're receiving some other types of supports, and clinics vary, how they're set up, and if you're receiving some other type of support from that clinic, you may see the therapist or the case manager, or whatever that is called in your clinic, more often than you see the psychiatrist. You may see your therapist weekly, or your case manager weekly, or bi-weekly, where you might only see the psychiatrist once a month, or you may see he or she every 3 months. It depends depending on the medication. So they're going to ask the same question. So again, I point this out because some people get irritated. He just asks me the same questions over and over again. Yeah, he's going to ask you the same questions over again, because that's like a screen. How are you feeling today? Any thoughts of harming yourself, of killing yourself, of killing others? Those are the questions, basic questions that a good psychiatrist or APRN is going to ask every time they see you. Right? They're going to ask about how you're feeling, any issues related to self-harm or self-harm of others. They're going to ask those questions, right? Also, you want to make sure that when you see the psychiatrist or the APRN, the prescriber, you want to talk, right? Many times people will say he or she never really talked to me. When they ask you how you're doing, they're asking you how you're doing related to why you're there. It's not how you're doing related to, my Pittsburgh Steelers didn't win and blah, blah, blah. You can go on and on and on about that, but you want to make sure that you're talking. This is your time, okay, about how you're doing physically, right? How are you sleeping? How are the medications going? You're doing with the medications. Any challenges with the medications? Any questions that you may have, okay? Because what happens in many clinics, especially when you're talking about community clinics, right? The psychiatrists, you don't have a whole lot of psychiatrists. You may have one psychiatrist for several hundred people. So that psychiatrist many times is not doing therapy. He or she is not doing counseling. He or she is not sitting down with you for an hour every time or 30 minutes every time, right? They may be only sitting down with you for 15 minutes at the most. well, at least 15 minutes. They're sitting down with you at the most. So during that 15 minutes, if there's something that you need, if you have a question, that is the time. You're talking to the expert in medications, so it doesn't make sense for you to be in their presence to leave and have questions. So you want to talk to the psychiatrist, even if it's not anything related to your mental health. You want to talk to them so he or she can direct you. Because again, it moves pretty quickly. If they ask you those questions and you don't have anything to say, well, everything is fine, how you doing with the medications, any thoughts of self-harm or harming others, no. They say, anything else? No, I don't have anything else. Okay, well, thank you, have a nice day. And then you walk out and say, hey, that was only 10 minutes. I had to wait for 30 minutes to see him or her. Well, that was your time to talk. What did you want to talk about? So it's a good idea to write your questions down. Right, to write your questions down, so that way when you go in to see the doctor, you can have your questions. You know what you want to ask. Okay, so keep that in mind. But going back to medications, and I'm reading from the handout here. You can get this at nimh.nih.gov, and I will post this on our website. Medications can play a role in treating several mental disorders and conditions. Treatment may also include psychotherapy or talk therapy. And it goes on to say that in some cases, a person may only need talk therapy. And that's important to know. So everyone doesn't have to take medication. Sometimes just talking to someone. Sometimes just talking to your pastor. Sometimes just talking to a friend can help you to kind of talk out some things. Talk out some things. So not everyone will need this, okay? But some will. So if you're one of these people that need to take medications, then you need to take your medications. Now, as we continually go on here, what you want to do when you talk about medications are broken down to different classes. There's some medications that specifically for antidepressant. There are some medications that treat antipsychotic medications. There's some medications for anxiety that specifically, and then there are some medications that can be used for other things as well. But again, this is something that when you sit down with your prescriber, with the doctor, these are questions that you can ask. But one of the things I do want to say, because what people tend to think, is that these medications are not, they don't make you, someone said, I don't want to take medications because they make me lose my thought or lose my mind or I can't remember stuff. Here's the thing, these medications are not designed to necessarily numb the pain and that you're a zombie. The medications get you to the point where it kind of quiets the symptoms so that you're able to think more clearly and that you're able to do the things that you need to do. It's not a magic pill that takes away all your challenges and all your problems. I think you still have to do life. Life, bad things happen to us all, and we have to learn better ways to kind of deal with it if we're going to be the person that we want to be in life, okay? I don't get into, fighting people to help. If you don't want to be better, you want to sit with your pain, then that's okay. All right, we're not here to fight about that. But I'm telling you that for medications, some people who take medications, their lives are much better because they're taking medications. There are some people who, because they're taking medications, they're able to go on to college. They're able to have a family. They're able to do it without functioning better. If my arm was broken and I needed a cast, right? Like really broken, and I needed a cast, and I'm walking around without the cast, but I'm walking around in pain. My quality of life is going to be poor. When I sit down, I'm going to, grimace in pain. I'm not going to be able to sleep properly. I'm not going to be able to interact with others because I'm focused on the pain. I'm focused on managing the pain. The medications can come alongside you and help you to manage the pain. Again, the pain of pain of what? The pain of depression, the pain of anxiety, the pain of not sleeping, the pain of having thoughts just whirling around in your head, the pain of tearfulness, the pain of just being anxious, the pain of racing thoughts. So all of these things are pain, because here's the thing. If you're so focused on trying to manage your symptoms, right? You know there's something going on with you, or maybe you at this point you don't, but there's something going on with you. You are challenged. You're putting weight on yourself unnecessarily when there's help there available for you. And those of you, again, who follow this broadcast, who follow us, you know we say providing information and support while encouraging hope and faith. When we talk about from a faith side, think about it like God has given us all things that's pertaining to life, to health and godliness, to life and godliness, right? His desire for us to be able to not just live a life so we can live a life for our own selves, but in order to bring Him glory. So we bring Him glory when we are able to perform in the way that we were originally designed. We bring Him glory when we are able to live, to operate into what He has called us to be. If He's called you to be a doctor, if He's called you to be a cook, if He's called, or a chef, if He's called you to be a social worker, whatever He's designed for you to be initially, you bring Him glory when you're able to operate in that, whatever He's called you to be. That's where He gets the glory, because from through that, His glory is seen. But what happens is the enemy tries to kill, steal, and destroy. What is the enemy? Thoughts, feelings, and behaviors that are contrary to the Word of God. That are contrary to the Word of God that says that you can make it, that you can do it, that you can be all that He calls you to be. So what other kind of thoughts that come? Thoughts that tell you that you don't need to take medications. And when you do. Thoughts that tell you that you don't need to get help, that you can struggle on your own. Struggle, you don't get a badge or an award because you're struggling. Oh, I'm struggling. I can do this. I can do this. No, Jesus Christ already hung on the cross. And He already rose from the dead, and He gave us gifts. And some of the gifts He gave us is how to better take care of these bodies. You're not, being untrue to the Bible or untrue to Him, or you're not hurting His feelings if you have to go see a doctor. We'll go see a doctor and take medications if we have a cold, if we have other things, menstrual cramps, if we have other things going on with us. But for some reason, when it gets down to mental health, we feel like we got to do it on our own. It's a taboo topic. We don't want to take medications, and that's not you don't have to feel that way, right? But again, the point I was making is that when you walk around with a broken arm, I'm struggling, right? All I'm focusing on is on my broken arm. It's hard to focus when you're in pain. It's hard to focus on starting a business or in being a better version of you, being a better version of the you that God has called you to be. Not just a better version of you, because we don't know what that is, but you want to be a better version of what God has called you to be, right? It's hard to do that when you're focusing on your pain. And that's what happens when you are dealing with symptoms, untreated mental health symptoms, because you are so focused on what's going on inside, you can't focus on what's going on externally. It's hard. It's hard to focus. It's hard to focus on graduating high school when you have thoughts running around in your head. It's hard to focus on getting a degree when you can't sit still. Every 5 minutes you're up pacing the floor. It's hard to stay awake in order to, let's say, to become a doctor if you can't concentrate, right? So again, physical symptoms. When we talk about mental health illnesses, it's not just, mental, it's also not psychological, but physical as well. When you have all of these symptoms going around in your head, floating in your head, or impacting you, it's hard to concentrate, right? So the medications can help to do that. People will say, again, I don't want to feel like a drug addict. These mental health medications are not the same as cocaine. They're not the same as crack. They're not the same as marijuana. They're not the same as all those other types of drugs that you take. These are medications, right? Some people may have to take them for a little while, and some people may have to take them for a long period of time. Some people may have to take them for forever. Just like, think about hypertension medications or other medications that you may have to take for a while, right? So let's talk about antidepressant medications. Antidepressants are medications commonly used to treat depression. Antidepressants are also used for other health conditions such as anxiety, pain, and insomnia. So like I was saying before, sometimes the medications can be used for other things. Okay? It also says, although antidepressants are not FDA approved specifically to treat ADHD, antidepressants are sometimes used to do so. Okay? And then there are different types of medications that antidepressant medications, right? So again, your doctor can talk to you about the different types of antidepressant medications if you need to take it. One thing about antidepressant medications, let me say here, antidepressant medications, let me make sure I still got it. Antidepressant medications do not work as fast as some of the other ones. So you will not, take the antidepressant medication at 8 o'clock and feel good in an hour. It takes a little while, right? So that's why you have to stick with the medications. You want to be, make sure you're talking to your doctor, letting them know what's going on with your medications, and that you're also continuing to do the other work. Because it's just not taking medications. It's also kind of taking a look at your thoughts, feelings, and behaviors. It's also taking a look at your habits. It's also taking a look at other things that's going on with you. Right? So you want to kind of continue to do that as well. So you have medications, right? All antidepressant medications work about as well as each other to improve symptoms. So there's different types of antidepressant medications, and they all pretty much kind of work pretty well. For reasons not yet well understood, some people respond better to some antidepressant medications than others. So again, what they're saying here is while all of the medications, antidepressant medications, kind of work similarly, kind of the same way, there's no research that said this one works better than the other, but we do know certain people respond to different medications differently. So again, that's why you need to talk with your doctor. Okay? Therefore, it is important to know that some people may not feel better with the first medications they try and may need to try another one. Oh, and again, let me stop here. People are saying, so these doctors are experimenting. They got me trying different types of medications and blah, 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 blah. And again, that is, one, they're not experimenting, but two, sometimes you do have to try different medications in order to make sure you get the right one. Because again, you're a unique person. You're coming with different symptoms. You got other things going on, a lot of things going on with you. So the doctor may have to try different medications. For a younger person or a person with no health concerns, who is in shape, they may work better with this type of medications. A person who is taking other types of medications, your doctor may have to try other type of medications. So